Hi, everyone. This is Dr. Katherine Kelly, and I am so excited to bring more information to you about the soul of psychology. Now, I started writing this book series a little over a year ago, probably about a year and a half ago. And really, the passion of this came from realizing that I needed to help people understand mental health from the soul side. Because basically, what's happening is healthcare and mental health care is leaving out the most important aspect of who we are. So, 2,500 years ago, when the field of medicine started, Hippocrates, the father of medicine, basically said, along with all of the people that worked around him, said that the soul was present in every illness and in every organ. And they wrote about this. They talked about this. This was really how the field of medicine started. And then they went through this whole morphing process of basically trying to figure out where the soul existed in the body and how it represented itself. And there's all these different aspects of how they did this. But today, in modern healthcare, in modern medical education, the soul has been completely left out of training, both for modern medicine and also modern mental health. And so I want to help you understand that there is a need, there's an importance to bring it back because, if you look at how medicine and mental health is being translated into the public and how it's being treated, there is something major missing. So, what I'm going to do for you today is I'm going to talk to you a little bit about my soul health model, talk to you a little bit about the model that I created in the midst of writing this book that's called the Soul Informed Care Model. I'm going to help you bring together the idea of why it is important to bring this back. Now, doing some research about this, it's very interesting because I tell people I live somewhere between science and woo because I really want to understand the science of everything that I'm working with. And I also want to understand, okay, what's going on in the spiritual world? One of the things that I did was I researched how many people are seeking psychological services and how many people are seeking spiritual services as part of their health. So you know, anxiety and depression are the top two mental health concerns. Not everybody who has anxiety and depression are seeking mental health services. Some of them will go for medications but never go for therapy. Some of them will go for therapy but never go for medication. Some of them will just ignore it altogether and basically stumble through life. And then there's this pocket of people who are seeking help through through spiritual services. So whether they're going to shamanic practitioners, whether they're going to spiritual coaches, whether they are going to intuitives or intuitive counselors, whether they are going to energy workers and people who can kind of help move the energy that is stuck within them. There are so many different spiritual practices, so many soul healing practices that are happening already that the major physicians and nurses and nurse practitioners and a lot of the mental health practitioners don't even realize that people are already seeking spiritual services to help them with what is going on within them. And number one, I think they need to know this. And number two, it's really important to learn how to integrate the services. It is integral as far as really helping people heal and helping yourself heal if you were dealing with mental health concerns yourself. So the Soul of Psychology series, what I'm doing is I'm isolating individual mental health concerns, and I'm talking about the body, the mind, and the soul. And basically, again, I'm opening the door, I'm opening the world for people to understand the soul side of mental health because it is the most important part of mental health. It's the most important part of physical health, as far as I'm concerned. So, about 18 years ago, I created what I call the soul health model. It's a holistic health model, it's a comprehensive wellness model that basically incorporates every aspect of the human condition that anybody tries to deal with or has to deal with in order to feel well. And as I've said a number of times before, way back in my graduate program, I was thankfully exposed to the National Wellness Institute's model of wellness, which has 6 different components of wellness. And so at the same time that I was learning wellness as part of this job I had, I was also learning sickness as part of my training program. My graduate training program was talking about what makes people sick emotionally, what causes sickness. And what was really interesting for me is that, and really fortuitous for me, is I started merging the worlds. I started realizing that we needed, in order to really be effective in healthcare and in mental health care, we have to merge the worlds of wellness and medical or mental health. So, what I ended up doing is about 18 years ago, I created my own wellness model that incorporated not only the six components of the National Wellness Institute's model, I'm talking too fast, but I also incorporated four additional aspects that basically no other wellness model had ever addressed before. And there are a couple in particular that I think are starkly missing from the wellness world, starkly missing from the health world. So I'm going to show this to you today, and I'm going to you can access this on my website. You can just type in Soul Health Model and you'll find it. But this is the model that I created, and it's obviously based on a tree. I'm a tree lover. But what I started to realize is that these components are so interrelated. These components have so much to do to work together to help a soul, an individual feel well, that it has to be anchored in something. And what it is anchored in is the soul. So people get the soul and the psyche confused. And so way back in my early training, we were taught that the soul and the psyche are the same thing. Now, very rarely did we ever hear the word soul in training. Now, I know, having been a medical school professor myself, I never once heard the word soul. I never heard it in the residency program I worked for. I never heard it in the nursing program that I did talks for, or the PA program that I did talks for. And so it was one of those things where over time I realized there really has to be something that anchors all of this. And so the soul to me is not a religious thing. The soul to me is the essence of who the individual is. It is what has been written as part of your story. And your story is unique from anybody else's. And the soul is the never-ending energy within us. It's that hub, it's that place within us, this energy within us that drives everything. So it drives motivation, it drives our thoughts, it drives our wounds, it drives basically any interests, any inspiration, it drives everything. So even though you cannot find it in the human body, it drives everything. Now, this third book that I'm writing on trauma, I'm explaining the whole idea of trauma, the whole idea of energy and how it is that every cell in our body is programmed with the essence of our soul. So basically, you can't diagnose something in the body to find the soul. The soul is in everything that we are. It is in every hair follicle. It's in every pore on our body. It's everywhere. But it's the energy within us. It's that essential nature of who the person is that makes them unique. So again, why I created this as a tree, and I had my graphics person really take the care to show that the soul is the sustainable part of us and that it upholds everything within the human condition. It upholds everything and supports everything that is true to who we are as an individual. And so it's really important for us to understand that this is a dynamic thing. This is dynamic nature. The human condition and what we experience in the human condition has all to do with how the soul heals or evolves. And the state of the soul and the way that we access it or don't access it has all to do with how the human condition is experienced. So it's a dynamic interplay between the human condition and the soul. But as a human, it's also the inner dynamic kind of situation that each and every one of these branches affects the other. So you can't be wounded in one and not have it negatively affect the other. You can't be well in one and not have it positively affect the others. So it's one of those things where there's this balance. So, when I'm doing assessments with people, a lot of times what I'll do is I'll overall say, how well do you feel? And they'll rate it from 1 to 10. And then I'll have them go through each one of these branches, and then their score changes. And it's because people don't realize that we have these 10 key components of who we are that need to be kind of nurtured along and brought into a place where we can balance these in a way that is going to make us feel healthy and well and whole. So if you take a closer look at this, there are 10 key branches of the human condition. These 10 key branches are really vital and important for us to be able to pay attention to each and every aspect in a way that we isolate it, we look at it, we hone in, we do some work on it, and then we back out, we do another one. So you can take this one by one, you can take this all at once, but really, this is a dynamic process. Soul health is a dynamic process. It is the process of becoming whole again. It's the process of becoming grounded in ourselves. It's the process of getting to know ourselves so well that from that point on, we are able to rebalance ourselves. So the soul of psychology aspect of this really talks about the body, mind, and soul. And I'm going to show you another model that I created as part of the Soul of Psychology series. And I'm going to show you how it interacts, intertwines, interplays with the soul health model. So this is what I call the soul informed care model. So first of all, let me show you what I mean by this. So we have the body, we have the mind, we have the soul. Most traditional treatment is only focused on the body, the physical aspects. That's where most of the research goes. That's where most of the energy goes. That's where most of the dollars go. That's where most everything goes as far as health. And we do have attention to the mind. So basically, there is some attention. There's more attention. The psychological field is much younger than the medical field. Psychological field only probably evolved about 170, 180 years ago, whereas the medical field started 2,500 years ago. So we do have, attention to the body, even though it's the smallest aspect of who we are. We have growing attention to the mind, which is obviously another very significant component. But what I'm going to do with this Soul of Psychology series, the book series, and also this video series, I'm going to help you understand how everything relates to the soul. There's a much larger component to who we are that needs attention, because if we ignore this part and only look at this, we are missing the entirety of who we are. So I'm going to give you a little bit more of a close-up and help you see basically that the physical aspect, the one branch on the tree, is this. So there's only one branch that is being represented from this entire model in this body system. So you have to really think about, wow, healthcare is really missing a huge component of who an individual is. When we look at the mind, so from a bigger perspective, when we look at the mind, the other 9 branches, so branches, 8 through 10, the rest of these branches are represented in the mind to some extent. Now, most people focus on the biopsychosocial model. That is what we're taught in medical school. That's what we're taught in psychological training. And yet those are only 3 components. There are 10 components of the human condition that need to be attended to in order for us to feel well and healthy. So what I've done with the soul informed care model and also with the soul of psychology is help people realize that we've got to expand the picture. We have to go deeper. We have to go wider. We have to really look at how everything fits together, because the entirety of this tree, and as I'm going to be educating throughout this series, this root system is something that I added as I started doing this Soul of Psychology series. These are all of the soul aspects. These are things like past life trauma. These are things like ancestral trauma. These are things like astrological personality, things like how the planets play a part in who we are, whether we have soul injury, whether we have, many, many different dynamics that affect us as, humans. We have to start attending to all of it in order for us to feel well and whole. And so I've already written the anxiety treating body, mind, and soul book. I've written the depression treating body, mind, and soul book. And I'm working on the trauma treating body, mind, and soul book now. And in working with trauma, even in writing this book, I'm realizing all of these aspects are such a part of treating trauma, and yet very few of them are attended to in modern healthcare. So this Soul of Psychology series is really here to expand and to help you really conceptualize how this goes differently, because I'll tell you, folks, we are missing big things, and it's time for us to get back to the soul. It is time for us to resurrect the soul back to where it first began in both modern healthcare and also, I should say, modern ancient healthcare, and also in the beginning of psychology. That is what the Soul of Psychology series is about. You're going to be seeing more and more of the models that I've created. You're going to be seeing more and more about specifically how is depression represented through the soul? How is anxiety represented through the soul? How is trauma? How is grief? How are relationship problems? How are every other mental health concern represented through the soul? Because that is where the golden nuggets are as far as healing goes. So I know this sounds more like an infomercial, but I wanted to kind of wet your whistle with understanding what the Soul of Psychology even is, because we've got to get bigger, we've got to get deeper, and we have to get more practical with how we do this, because a lot of the treatment that's out there is helpful, it is just not everything. So we need to get into back into the soul and bring that into a place where we can understand it as an everyday part of life, because that's what it is. Every individual has their own story that is written by their soul in the experiences they've had, the traumas they've had, the joys and the jubilations, as much as the difficulties. So that's what this is about. I'm going to be bringing more and more to you, and it's going to hopefully enlighten you in terms of what is keeping you stuck, as well as if you're a practitioner or a coach or an educator or administrator, it may help open up the doors for what you can start teaching. Have a wonderful day. I would love to hear your responses and your questions, as well as your comments, and I will be back with more and more information about the psychology of the soul. Have a great day.